Well, hey everyone, welcome to the National Spine Health Foundation. I'm your host, Erica Anderson, and today is World Spine Day. And so we're really excited to be celebrating that with an interview with Dr. Shay Bess, and he is the president of the International Spine Study Group Foundation, which is a nonprofit multi-center research foundation that investigates treatment outcomes for people with scoliosis and other spine problems. Thank you so much for joining us today, Dr. Bess.
My pleasure, Erica. Thanks for having me.
Yeah, well, we always like to get our interviews started hearing a little bit about you. Tell us about your background and what drew you to the world of spine surgery.
Yeah, sure. So I practice and live in Denver, Colorado, and treating primarily adult and pediatric patients with spine deformities, so scoliosis, like you said, as well as patients requiring revision spine. The things that drew me into spine, I think, really speaks to the types of patients that I treat. The great thing about spine surgery, spine care, is that it is such a diverse field that I believe that it allows you to apply yourself in many different aspects of it. The clinical care is extremely satisfying, as is doing surgery, but also treating patients, interacting with patients, and especially doing research and development on items that can help those patients. I think that speaks very broadly to, again, the work that we do through our research foundation, the International Spine Study Group Foundation, which is focused on adult patients that have large or severe deformities, namely scoliosis or kyphosis, or have required revision spine surgery because of a failed previous surgery. So our ability, I think, to help those patients, not only clinically, but then also to help them and or their physicians by doing research that reaches a broad number of patients, I think has been extraordinarily satisfying.
Yeah, that's awesome. It's always great to hear sort of the passion behind what you do. Now, as we mentioned, it is World Spine Day. And so my question for you is just, what does that mean to you to be a part of helping so many people get out of pain and get back to the lives that they love?
Sure. Again, and it speaks to the reason why I went into spine. I think the mission, not only for my practice, but for our efforts at the International Spine Study Foundation, is to help patients achieve the things that they want to from a pain function standpoint as well as a lifestyle standpoint. I think that the main thing that we're trying to do really is to understand these patients, understand what they want out of surgery, and then also understand what we can deliver by doing surgery for those patients. And so I think, again, finding the appropriate patients for care and then tailor making that care for each individual patient. It's always a balance between treating the individual, but then, okay, how do we take that message to a broader population? So on one hand, you're impacting one individual or one patient at a time, but through the research, we're reaching tens of thousands of patients through education, not only for the patients, but also through their physicians.
Yeah. So let's talk a little bit about the study group. You founded it. Can you give us a little bit of background on the history and what gave you sort of the vision for creating such a group?
Sure. So the group initially started as a user group. It was ISSGF Study Group, which is an old implant platform created by one of the icons of spine deformity surgery, Mark Asher. And then as the group evolved, it stayed more as a user group, and there was an impetus for it to want to really become a study group. And so I was asked to come on board in 2008 to help create the database platform, namely the data fields that the group uses. And then as we grew, not only in numbers, but then in focus, namely, can we expand it clearly beyond just an implant system? How do we help these patients as a whole? We then adopted our mission, which is really to help patients with, again, spine deformities and or failed previous surgeries. It's been wonderful because we've really been able to develop the group as really a business and or department. And what that looks like truly is we have different focus groups within the ISSGF, or International Spine Study Group Foundation. There's a cervical group, there's an MIS group, there's an outcomes group, there's a complications group, there's an economics group. And so what we do now is tease apart the different aspects of patient care And then in doing so, we can look at very fine details, or we can also then broaden that to a large platform that allows us to message and speak to larger concepts. Who's appropriate for surgery? Who's not appropriate for surgery? What can we expect from the surgery? But also then in teasing through what patients' goals are, and then how can we work with the healthcare system to make that these care profiles affordable as well as beneficial for the patients.
Yeah, there's just so many different aspects that go into everything. I think that's awesome to have, taking that well-rounded look at it. Now, the world of spine, I mean, just like everything else in healthcare, there's been so many advancements and innovations in the past 10, 20 years, and things just continue to improve, which is awesome. So when you look at, what research you're seeing or what new things are coming out, what is making you the most excited that you're seeing?
Sure, I think that our ability to recognize and gain a cognizance of what patients want from the surgery and being able to predict if they will do well and can we achieve those goals, right? I mean, the technical advances can only go so far, especially if technically a surgery or a care platform is done well, but there's still a poor outcome. And so there is this discrepancy that can exist between those two aspects, namely the technical aspect, even if it's well done, sometimes the patient doesn't do as well or doesn't achieve the goals they want to achieve. And so what excites me most is identifying not only what the patient wants, but then predicting, are we going to be able to achieve those things for the individual patient? So we published a paper just a few months ago now looking at are the anticipated outcomes for spine patients with spine deformities. And what we found is that the outcomes are very different based upon the type of scoliosis and or kyphosis the patient has. And what that's telling us is that we need to listen to what the patient is telling us, because only then are we going to be able to help them in those health domains that they have a deficit in. So if they're having surgery for pain versus having surgery for self-image and the deformity itself, those are very, very different things, as is functional performance, as is social interactions and social function, as our return to work and or getting off of opiates. Those are distinct entities. And so if we can tease through, again, not only what the patient is hoping to get from the surgery, and then looking at how we perform on that type of patient, we can honestly counsel that patient on our ability to achieve what they want.
Okay. Now, a question follow up on that just is, back surgery, if you look online, some people are telling horror stories and people are very scared of it and it has a stigma to it. And so I would love to hear about how maybe some of your research can disprove some of the myths out there, or, kind of push back on some of those, stories that those horror stories that are out there.
Sure, and that I think speaks to what we talked about previously is what we find now is that just as there are multiple different types of surgeries that one can do, there's multiple different types of patients. And so to say that spine surgery is bad and there are horror stories associated with it, I think that we need to sort out who is getting what type of care, and our ability to optimize the care that the patient receives really speaks to our ability to tailor make that surgery or that care, quite frankly, for that patient. Namely, again, identifying what their problems are, not only anatomically and physiologically, but also where their deficits are. Do they have a problem with, again, pain or function, or is it self-image? And only think then can we provide effective care and avoid, again, some of these, as you alluded to, horror stories. Namely, the patient didn't receive the care or the outcome that they wanted to. And it's probably, again, because there was a misunderstanding and what that patient really wanted. And I think beyond that also is if we can profile patients that are at risk for a complication, we can then optimize that patient. Complication management is interesting because I think that what you want to be able to do is optimize the patient so that they then can have the best care possible and be in the healthiest possible state, not only to receive treatment, but to recover as well.
Yeah, that's such a good point. So many different things affect how a surgery goes, expectations included, so important. And I also say that so many times the very good stories, which are many, those people they're not on the internet complaining about it. They're just out living their lives. And so that's one of the things we do at the Spine Health Foundation is try to find those great stories and turn them into, we call them spinal champions, and kind of distribute those to let people know, like, you don't need to be scared. Like there are solutions, there is hope out of your pain. Okay, so I guess then I would just ask you, what would be your words of advice to someone that is a little nervous, but they're getting ready to have surgery for the first time?
Sure, I think that a key portion to that is articulating the things that you want. Look at your life, look at the things that are causing you either pain and what you want to change in your life. And I think it's very important to be able to identify what your main problems are and then articulate that to the people that are providing care for you. And whether it's surgery or no surgery, articulate what you're hoping to get out of your care, and then find a doctor that listens to what those problems are, and then honestly ask, can you help me with these specific problems that I have? And I think only then, if you engage in that conversation and have an honest communication exchange with your doctor, I think only then can you come to likely a happy outcome, namely achieving what you want as a patient, but also having the doctor honestly be able to say, well, I can help these things and maybe some other things I can't help. Because then you can weigh the risks and benefits of different types of care, whether you have surgery or not. Right? That you can say, well, I can help you with this, but I might not be able to help you with that. And then you'll be able to come to, I think, the conclusion, is this treatment going to be effective for you?
Yeah, get clear on the specifics, bring in all the questions, write them down, make sure, everything is answered. I think that's such a good point. Well, Dr. Bess, thank you so much for joining us for World Spine Day. We are really glad that you could join us. It was great to get your insight, and we just thank you so much for all the work that you're doing.
Erica, it's my pleasure. Thanks for your time.
Okay, that was it. Pretty painless, right?
Totally painless. Thanks so much.